All attendees are in listen-only mode.
Hello everyone, and welcome to today's broadcast entitled Data, Data Everywhere, Now What? My name is Marilyn Marchand, and this webcast is brought to you by Polaris Strategic Solutions. Let me start with a few logistics before we hear from John Orifice, President of Polaris Strategic Solutions. All lines have been placed on mute to prevent any background noise. We welcome questions, though, and we want to provide you with timely answers. So if you have a question during this webcast, simply click the hand icon that's in the upper right corner of your screen. If you expand that panel, you can type a question and we'll be sure to respond. And now, without further delay, here's John.
Thank you, Marilyn, and hello, everyone. And thank you very much for participating in our webinar. And let's get started. There are three primary things that we'd like to accomplish today. And you can see here that, and this will be probably about 30 minutes or so. You know, reporting efforts take on many shapes and sizes. People need information and do whatever they can to get it. So we're going to take a look at some of the things to avoid in developing effective reports and reporting systems. We're going to focus on developing one reporting system that can really meet the needs of your entire organization. And we'll be talking about how really reporting happens in silos, etc. And finally, we'll summarize it all with an 8-step blueprint that says, you know, here's the process you should go through to try to achieve a robust and comprehensive enterprise-wide reporting system. This is the good old days, and for many of us, the good old days are actually still today, which is an interesting thought. But the good old days, we had, you know, plenty of information available to us, but access to that information was time-consuming, very limited in scope, and very limited in accuracy. So as an industry, we're trying to move forward. And so now we're electronic, so this should be great, right? Look at all the wonderful sources of information available to us. Reporting should be a dream. We have electronic health records and information exchanges, so we should have a wealth of information about the patient. Data warehouses and repositories bring data from all across the enterprise to a single source for information. Analytics and business intelligence, the terms are kind of interchangeable, allow us to manipulate the data to bring a better understanding closer to our fingertips. So we should really be in reporting heaven. How many of you feel like you're in reporting heaven? Unfortunately, we're not quite in heaven yet. Despite the ready availability of electronic information, we still grapple with many problems. For example, multiple sources of data can lead to multiple answers to the same question. The ever-present, how many discharges did we have? And of course, you know that 5 people bring in a number and they're all different, and they all seem to have a legitimate way that they came up with that number. We need to develop agreed upon definitions and sources for the data. You'll also find many different reporting initiatives throughout the organization. One group is looking at some new dashboard program that they saw, and another group is focusing on tools supplied by your HIS vendor. Or others, in fact, most are probably, you know, mired in spreadsheets. And we really need to develop a one-stop shopping place for information. It's amazing to me how many times in the process of working with our clients we hear about they just found out that Dr. Smith came back from some seminar where they were pushing some sort of software, and so now Dr. Smith is really anxious to get that software, and Dr. Smith has absolutely no idea if it really would work properly or if there's already something in place that does the same thing. So there's a lot of everybody working in a vacuum going on in terms of being aware of other initiatives for reporting. And it's not easy to get all of them to sort of throttle back a little bit and work with you to focus on one thing. Typically, you'll find that report requests take months to fulfill. We normally, when we're talking to clients, are told that they're currently, they get requests, and then those requests could be a month, 2 months, 6 months out before they expect to be able to meet that particular demand. The process is ill-defined. It's carried out by many different people from different parts of the organizations. Priority shifts and the best of intentions don't happen. I can remember being in the briefing center talking to a room of C-level people, and I would be going through a demo of systems, and they would invariably ask the question, is it really as easy as you're making it look? And I would always say, look, if we can't make it look good in a demo, you definitely should be running in the other direction. But assuming that what we're showing you is in fact possible, you have to recognize that you need to allocate resources. So you need to say, we have to have 2 people working on this full time. And we would always get the same answer, which is, absolutely, this is vital to our organization, we're going to do this. Of course, we would go back later on and find out what's going on after installation, and the reality was that either the resources were never allocated or they were redeployed the minute the next crisis occurred. That doesn't work. You have to be able to have consistent resources, and you have to somehow get past the idea that by the time somebody's trained, they move on to another position. Reports are typically abandoned when they don't exactly meet the needs of the end users. The old canned reports almost always fail to accomplish the end user's goal. Instead, you need a solution that continuously works with the end users to tweak the report until it is precisely what they need. I always tell everybody, this is an iterative process. You sit down, you meet, you come up with a preliminary design. Everybody looks at it, they say, well, it would be better if we could add a column that does this. Is there any way we can make the negative variances red? Can we sort this in a different way, etc.? You have to constantly do that. If you don't, people start to not use the reports. And one of the best tools to sort of measure your effectiveness there is something that monitors the actual use of the reports. So for example, in our system, every time somebody opens a report, that's logged. So we know who opened which reports and when they open them, and that gives you a sense of whether or not the report is being effective. And if it's not, then you need to go back to them and find out why. Here is a graphic that does a nice job of showing the different levels of reporting capabilities. So at the start, we have standalone spreadsheets. These are everywhere, and they do serve a purpose. They do not, however, constitute a viable enterprises-wide solution. They are very prone to error. They frequently are not properly secured, and they meet the needs of a very few number of people. Now, the next level we go to is operational reporting. So this is typically the reporting capabilities inherent in whatever system you're using. You know, if you're a Meditech customer or a Siemens customer or an Allscripts customer or an Epic customer, whatever system it is, invariably they come with some sort of reporting capabilities, and invariably they're extremely limited. They typically are slow. I mean, we have people telling us that they run a report and it takes 24 hours. So for those of you who have suffered through things like that, I can only imagine you wait 24 hours to find out that, in fact, you got the report wrong. You asked for something that you meant to ask for something else. So, so they're slow. They're typically not interactive. They're still geared to the idea of paper reports, etc. And they have no way to cross-link with data from other systems. They're just built for themselves. Now, with tactical reporting, you make kind of a giant leap in the right direction, because now you're looking at a system that is free of the limits of operational reporting. once you start to bring your data into some sort of data warehouse or data repository, whether it's your own or more typically one that's provided by your, let's say, your HIS vendor, once you get there, you really start to gain in capabilities in terms of consistency of information, the cross-link of information from different systems, et cetera. So when we start to look at things like productivity reporting, where we're looking at FTEs per unit or expense per unit or whatever, and we're pulling data from multiple places to make that happen, this all starts to take place when you get into more tactical kinds of reporting. But the goal is to achieve enterprise reporting, which is in fact what we accomplish and provide as a service from Polaris. I mean, of all the important points that are shown on this slide, perhaps the one that's the most important is the part that says skilled staff. If you look at the challenges for enterprise reporting, it says requires enterprise-wide strategy and skilled staff. And that's where effective reporting really starts to happen. It's just like anything else. You know, no matter what you're doing, you're always looking for people who have a particular expertise to be able to make that happen, whether it's, it's on the clinical side of the house or on the administrative side of the house. You have people who have developed a particular expertise, and that's what makes them effective at their jobs. Well, it's the same thing with reporting. Just because somebody knows how to use a spreadsheet doesn't mean that they, in fact, have the skill set you're looking for. So you need to try to develop that internally or get it externally or whatever, but you need to try to build a consistent group of people who are experts at data visualization. I'll be honest, few organizations recognize this to the point of actually hiring experienced data visualization experts grounded in the healthcare industry. They're much more inclined to just take people already in the organization and say, could you please work on this for us? So this, again, is it's very important. It is what Polaris brings to the table. True enterprise reporting needs to marry up a superior tool set with experienced experts. So this little graphic that Marilyn found showing somebody struggling to climb to the next level, let's talk about that. How do we get ourselves up to that higher level, the enterprise level? First of all, you need to take an organized approach, obviously, to developing enterprise reporting solutions. The first thing would be to establish what you want to accomplish. Consistent data, rapid response, automation. Automation is key. For the most part, we'll have reports where it requires someone sitting down and gathering up the data, getting it into the spreadsheet, formatting it, et cetera, et cetera. You really have to automate virtually everything. You really have to have a system that says, okay, every day or every week or every month, whatever's relevant, this is automatically being available, which means when people go to use your system, they always know they're looking at the most recent data. You need somebody to sponsor this, and really that person should be at the C level. Interestingly enough, even though this is something that heavily impacts on IT, a lot of times the main person who is sponsoring it is not an IT person. It's frequently the CFO or some other senior member, the COO, some other senior member of the management team who is the executive sponsor. It's very important that you maintain a continuous data flow back and forth with that person. We tend to meet with ours on a monthly basis and find out, what impression they're getting from people about the system. Are there any issues? What are their priorities? What would they like to see next, et cetera? So you have to stay in communication and get that sponsorship. You also have to identify the next level, which are the stakeholders, the people who are really going to be using the system heavily. It's really a good idea, in fact, to try to find stakeholders who you know are going to be very cooperative in the beginning because you want to get those early successes. We find that we have meetings with stakeholders much more frequently, weekly or bi-weekly, where you're discussing the latest reports you've done. They're taking a look at what those things can mean, evaluating where they want to go next, giving you any ideas about ways to tweak the reports to make them a little better for them, etc. The communication is just so important. It can't be that they make a request for a report, it goes into some whole vacuum something somewhere, and then eventually down the road you get back to them, and then they come to you and say, okay, it turns out we needed this little change, and then you don't get to it again until like 2 months later. At that point, it's gone. It has to be a very fast, rapid response type of thing. You have to make sure that your project priorities do in fact tie to the needs of the organization, meaning that the organization has some critical thing that they're focusing on at that point, whether it's productivity or length of stay reduction, whatever it happens to be, quality reviews, etc. You have to make sure that you are tied into that so that you are responding to those things, and they will shift. So you have to be willing to shift too. You have to be willing to say, you know what, this used to be our #1 priority, but really right now the organization, due to whatever, needs to really refocus on this particular thing, and you need to be able to make the shift with them. So you just continuously communicate through meetings and email communications, etc. And again, the importance of checking report usage. That is one of your main measures of how successfully a particular report is meeting the needs of the end user. If you see that people started to open it and then just stopped, you need to go back and find out why. Resisting spreadsheet proliferation, kind of a hard word to say, and Marilyn also found another funny graphic here. There are certain things here. I mean, probably the hardest step is to break the spreadsheet habit. For all their complaining, end users do not like to relinquish control of their reports to others. You have to win them over. Ultimately, they'll see that you're saving them a great deal of time. We had one particular client where one of their individuals spent 40 hours a month, so a quarter of their total time on one report, which would then become available like a month and a half after the end of the period which the report was reported. So you have to ultimately buy their acceptance by showing them that they are going to be able to save a great deal of time, that the reports are going to be refreshed every day so that people looking at them are always looking at extremely recent data. We do tend to refresh almost all our reports daily so that people who need it can actually see data partway through the month so that they don't have to be waiting for month-end reports to then find out that, gee, the month was bad for some reason or other, and if we had known this sooner, we might have taken certain sort of action. I'm not saying that spreadsheets aren't great tools. They are great tools. They're unbelievable. And they were, one of the main things that really led to PCs becoming popular. But they don't really answer the needs of an enterprise-wide solution. And you have to break people from their dependency on them. So there's a lot of different things that we can look at to decide how to display the data. One of the key things of all this is the concept of data visualization, which is how am I going to present the data so that it's easy to use, that it makes its point quickly as opposed to buries it. I've gone into I don't know how many meetings where I'd say, can you show me the report you're currently using? And they would get out a stack of like a 100-page report and say, this is the report. And I'd say, well, how do you find anything in there? They go, well, you can't. You can't really find anything in there. So fortunately, with the advent of electronic monitors and electronic databases, et cetera, we can go past that idea of these big stack of paper that you can't really find anything in. Some of the main types of tools we can use are grids, which very much look like spreadsheets, dashboards, just typical graphs, control charts, which are very popular with, especially with quality personnel, because they show whether or not a process is considered statistically in or out of control. Indicators, things like, admissions, discharges, surgeries, quick things that you want to see and monitor. Cubes, which is kind of an industry term for those of you who have worked with pivot tables in spreadsheets, that's really what a cube does. But the cubes that are available for big databases are kind of like a pivot table on steroids. They do much, much more and can handle large, large amounts of data that would choke a spreadsheet, that's for sure. And then finally, Adhoc. This is really important. This is where you provide an environment where people who are not SQL experts or IT experts of any kind can actually go in and get their own answers. It saves a tremendous amount of time for the IT team or whoever is the team that they would end up going to. So let's take a look at this list again and see where we think they best slot in, and then we'll take a look at actual examples. So here's a list of those tools. Grids are best for handling large amounts of data and for displaying that data in a hierarchy. So for example, you might have some financial data and it starts with the total organization and then it goes down to the division and then it goes down to the department, et cetera, or FTE data that starts to go down into the earning job codes and then earning categories, et cetera. Physician data, which might start by specialty and then break down into group practices, et cetera. So that's where you might be. Those are good places to be using grids. Dashboards. This word, it almost starts to bother me because it's been so used for anything you can practically think of. It's sort of lost its meaning. But they're really supposed to be for quick looks at data, something where you can take a look at something, get a quick idea of what it is, and then move on. One of our CFOs once told me that she comes in the morning, she goes into Polaris, and in 5 minutes she sees everything she needs to see to get her day started, and then she's gone. Now, sometimes things happen during the day, and she comes back for more details, but that's what you really want from dashboards. You want that people can come in, get a quick look, and then feel comfortable that they know what's going on around them. Graphs are best used for trends. That would be where, I want to see how things have developed month by month, week by week, whatever, or for comparison information. Control charts, as I mentioned before, they're great for things like process improvement, where you're trying to see, again, if a process is in or out of control, or if specific changes you made at some point actually led to the process going into control. And again, focus very much on the quality side of the house. Cubes, as I mentioned, they're like pivot tables on steroids, but it gives them the ability to change what they're looking at on the fly. And then finally, we mentioned the Adhoc, and the Adhoc does give you a great way to answer many, many people's needs with virtually no effort on the part of the IT staff. One of our clients, who has over 400 people using our system, probably generates as many ad hoc reports a day as they are looking at the ones that were actually built in advance. It's an amazing thing to see, but they have something like 100 different what we call data sources, but tables of information for different people to use. Of course, security is in everything, so people can only see what they're supposed to see. But they have a tremendous use of this ad hoc system, and I think if you have an ad hoc tool in your organization, you would understand the power of it, but it shouldn't be limited. Most of the times you go in, you find just a few people who are using it. They've got hundreds of people using it, and it's been very, very effective for them. Okay, let's jump over to take a look at what some of these things might look like. So the first one I'm looking at is going to be an example of a grid. Now, this screen is the Polaris viewer. This is our main end user tool where you can see, and I know that it probably looks small on your screen. That's part of what's happening as a result of the webinar, but hopefully you can at least see enough to get a sense of this.
Hey, John, it's Marilyn. Sorry to interrupt you, but I wanted to point out to our audience that there is a zoom function in the upper left-hand corner. And if they're having trouble seeing the detail, because this does have a lot of information on the slide, you can change that zoom level to like 75, 80%, or even 100% if you want to see in real great detail.
Thank you. Okay, great. So you'll see that, on the left, this is a list of all the, this is a demo system, but it's a list of various reports that might be available. So the first one I've picked is this thing. It's profit and loss with summaries. This is to show you an example of a grid. So you can see it starts at the corporation level. And when I click, it drills immediately into the account class level. So you can see revenues, free care, et cetera. So this is a summary of all that information for the entire corporation. Then if I go down to a division, let's say I go to outpatient, okay, now I'm looking at a summary for a specific division. The reports can drill as far as you need them to drill. So for example, this one keeps going. It then allows me to get into the departments. So if I pick like the lab, for example, and then I see the data summarized for the lab, and then I can actually go down into the cost centers, and I see the information there. So it's a tremendous amount of information. You can see this actually then eventually goes down all the way to accounts. And so you can limit this, or you can bring it in with as much data as you need. Grids should be things that are easily sorted. So for example, if I wanted to look at my variances, I could click on a column heading, and that automatically started to sort this from lowest to highest, or I can do it from highest to lowest. So you can see how there's a certain interactive nature to grids with a tremendous amount of information. I mean, you can't even imagine how you would somehow depict this level of detail graphically. I mean, you just couldn't do it. So that's where the grid really shines, with the ability to see lots of data, to be able to show comparative. Notice how in this particular case, for example, we've got the data and the actual data, the budget data, variances, and then even what happened last year, which is a typical kind of budget format. So okay, let's move on to the next one, which is a dashboard. And so here's a typical kind of dashboard look. This is what a lot of people sort of in their minds, I think, envision as dashboards. You can see we're using many different kinds of elements here. So we have gauges. Gauges are really good for a quick look at a major indicator. You can see here we're looking at market share, and you can see that the colors in the gauge are helping to denote whether or not it's an acceptable value, a sort of somewhere in the middle mediocre value, or if it were red, then it would be an unacceptable value and needs work. You can see how we've also deployed some graphs. So for example, here is what's called a funnel chart that is showing us the percent of operating income by product line. So we can see where our operating income is primarily coming from, et cetera. And here we have a bubble chart where we're looking at the change in market size. So as we go from right to left, the market gets bigger. And the change in market share. So the higher we are up, the more of the market we control. And so, of course, what you'd like to see is that you have lots of market share in a growing market. So something like this is very positive. Interventional cardiology, you could see, is positive in terms of your market share. Unfortunately, it's a declining market. So this is a very good example of a typical dashboard. And this one, this is focused on product line information. Okay, so let's move on to our example for graphs. So if I go to ED reports, and I think we're going to look at the turnaround times. Okay, so here is a graph that is showing us emergency department turnaround times, and you can see that we're looking at this, day by day, and inpatient versus outpatient. So time scale is a very common use for graphs. We wanted to, here we're looking at this, how it differs day by day. Or if you wanted to look at trends of information, you might be looking at things by month, etc. This is, which I'm sure you're all familiar with, a stack chart, where we actually have the information that brings us from one piece to the other. So we have the reception, the patient came to reception and then got into a room. So that's the red section. So on average, on Sundays for inpatients, that was 25 minutes, etc. So this is a really good use of a graph to display information that's comparative. Graphs, as opposed to grids, are very good, especially when you look at trends or at simple comparisons that don't have lots and lots of data elements to them. Because looking at a string of numbers, it's hard to say, well, this one's bigger, this one's smaller, etc. But here, it really creates that visual image that makes it much easier for people to understand what they're looking at. Let's take a look at a control chart. This is kind of interesting. This is in our quality section, and oops, I closed myself out. This is a different kind of dashboard. This is a dashboard, instead of the one that had the fancy funnel chart and the gauges, etc. This one is much more almost looking kind of like a grid, but it's different capabilities. So here you can see that we've broken out the quality into many different categories. And we provide information that shows how you're doing against your target, etc., and does give a status indication so that you can quickly see which ones you might want to focus on. But what it also does is it gives you a way to get into greater detail when you want it. And that's very important for any dashboard, that there's a way to quickly link to the next level. So for example, if I looked at the Polaris West Hospital inpatient falls per 1,000 inpatient days, and I click on that, I get a choice of different other reports I can go off to. I can go off to a trend report that shows me what the falls were, and then of course it's a ratio of falls per 1,000 days. So then it's how many falls and how many patient days, and we can see the trend. Now the ones that drop at the end are because we were looking at the time at current month data also, which you can choose to include or not include. But this gives us a way to say, well, if the ratio of falls per 1,000 patient days changed, did it change because of the number of falls? Did it change because of the patient days? Did it change because of both, etc.? If I go back to my list here of things, I see that one of the other things is a control chart. And so if I click on that, I now bring up a statistical control chart. I don't know how many of you are familiar with control charts, but they basically provide an envelope, a lower limit and an upper limit, within which values need to remain for the process to be considered in control. Now, there's a lot more to it. For example, even if you're within the controls, but you have, let's say, 4 downward or 4 upward months in a row, then that shows something's going on also. So there are, I think there's 8 criteria that we test for determining whether or not a process is in or out of control. Again, heavily used on the quality side, not so much on other sides, although we do provide these for clients and for things other than just quality data. And then let's take a look at indicators. So for example, this one probably looks very small on your screen, so I hope that zoom feature works. This is something where you can quickly see how you're doing. So this was, back in November of 2012. You would normally, this would be whatever the current month is. So right now you'd be looking at February of 2014, and you can see for the current month exactly how you've been doing in terms of actual versus budget. I'm sure you can't read these, but that's what this says. The red is the current year actual, and the blue line is the current year budget, so that you can see how you're doing against your budget. And then aside from the day-to-day look at how you're doing, you can see how you're doing for the current month and how you're doing year-to-date. So there are many different indicators that you might want to look at. You can see here we look at census, patient days and length of stay. So if I click on that, then that one opens up. ED registrations. There are a lot of different things that are considered, some sort of key indicator that people want to look at, and it lets them see a very short-term approach to what's happening, a month approach, and then a year-to-date approach. So that's for indicators. And the last thing I'd like to show you is, and I'm not going to do any detail on this, but just to show you how nice it is to have, ad hoc capabilities, in our case, right in the system. So what the ad hoc gives you the ability to do, if I could drag that open a little, is go and pick a source. I'm going to pick inpatient data. And then you see what it brings up is all this data that you can use. We have, scrubbed the data, so that's what a lot of these numbers are. But you can see we have the hospital, total charges, length of stay, ICU days, who was the attending, who was the surgeon, who was the consulting, zip code for looking at things in terms of market share or how your caseload has been changing in terms of geographic distribution, DRGs, gender, payer, race, primary diagnosis, on and on and on. In the ad hoc environment, what happens is, and again, I won't go into the details, but you get to pick what you want. In other words, if I didn't want all these things, I would say, no, I don't want all that. I just want the hospital name, the total charges, the DRG, and the payer. So it's an environment where the end user gets to say, well, this is what I want to look at, and then they get to set filters to say, and I just want it if it's this or that or during this time frame, whatever they want, and they get an answer, most of the times in seconds. So that is a great way to answer a lot of the reporting needs you have, where you don't have somebody come back and say, oh, I have a question, and then you answer it, and then they come back and say, oh, you know what, now I need to know by payer, and et cetera, et cetera. An ad hoc tool integrated into your reporting environment is really powerful for meeting a lot of those needs. Let's take a look back at the presentation and move on to just take a quick look at, what are some of the areas that we see people focusing on. So, of course, budget comparisons are, everybody needs that kind of information. So you have budget comparisons both on the expense, revenue, and unit basis, and of course on for your FTEs. People like to do a lot of aging reporting, so looking at your AR or net contribution. On the quality side, we've done things for core measures, care measures, process accuracy, risk management. You saw an example of that with the falls data. And then, of course, you have, hospital-based infections, et cetera. Performance improvement, this is looking at, well, for example, admission and discharge trending to see, what's happening in terms of different, especially by service line, how things are growing or shrinking. Reimbursement patterns, looking at, getting at net revenue numbers. Competitive position, looking at yourself in comparison, using data from state databases, et cetera, to have a constant look as opposed to looking at your market share every 3 years when you update your strategic plan. It's something that can be looked at and monitored on an ongoing basis. Meaningful use reporting, of course, is a big topic now, and so we do a lot of that. But this is literally just the tip of the iceberg. You wouldn't believe the requests we get. I mean, we had a request for monitoring ambulance companies, and how often the ambulance companies came to the hospital and looked at it by day of week and time of day and kinds of cases, et cetera. So it can be anything from the most macro type of data element to the smallest thing that somebody is investigating. And one of the things that you need to sort of focus on is making sure that there's some consistency. So for example, data in common, this is a big deal. Like for example, doctor masters. I mean, how many doctor masters does your organization have? 1? That's very impressive. 5? That's more normal. So you want to have something, you know, if this is all going to work, where this all starts to come together. Length of stay. I'm sure those of you on today have had issues with how do you define a length of stay? Do you define the length of stay as take the difference between the discharge date and the admission date and then say, well, whatever the difference is, that's the length of stay? Or do you say, no, we're going to look at how many census days we had this month and divide by the number of patients? You know, those kinds of definitions have to be decided upon in some sort of data integrity committee type environment where there's an agreement on how are we going to look at length of stay. Now, I will say this. There are times where it's totally legitimate to have multiple definitions of something. It just becomes very important that it is obvious on the report whether there's a definition available or if it's in the title or whatever as to how that particular calculation was made. Another important thing is how are you deciding which month to categorize something in? Are you using the admission date? Are you using the discharge date? You just have to make sure that you're consistent. We frequently find that we've got some reports where we're using discharge date and other reports where we're using admission date, and guess what? The numbers aren't the same. So you need to make sure that things are consistent up and down the line. And finally, our last slide is the blueprint, which is really a repeat of what we were talking about. We talked about the fact that you have to do this from the top. So you need to get an executive sponsor so that there is an incentive internally for people to work with you. You need to meet with stakeholders continuously. You need to identify who the primary stakeholders are going to be and then start to work with them. Over time, that the number of people that are stakeholders definitely grows, but that's okay because you hit a certain kind of stable point with each of them, and your particular time efforts start to decline. Agreeing on guiding priorities. The problem with it, we talked about priorities earlier, is that there could be a gazillion of them, and so you really have to sit there and say, okay, we need to stop it. We need to go for the top ones. So what we have done with clients is we've actually put a report out that is something showing all the different reports we're going to work on, why we were going to work on those particular reports, who is the person that is the key individual responsible for this, and then assigning to them priority values so that within the organization it's understood what are the things that we're going to go for earlier rather than later. Centrally manage the data. This gets back to you can't have 5 different people using 5 different data sources to come up with the same number. The idea of the visualization skills, remember I said earlier, there's really an expertise and a skill to data visualization. It's not as simple as highlighting the area on your Excel spreadsheet and saying, okay, turn this into a chart. Communicating regularly. Don't let these things slip by having regular weekly or biweekly meetings. You really build a strong bond with your work with everyone. But I have clients, I know one of whom is on the line, so I'll say this, where we don't have a day where there isn't some form of communication. Either it's emails or phone calls if it's not one of an actual scheduled meeting, but that's really the best way to operate. Automation, as I said earlier, totally key. If it's not automated, it's not going to work. It has to be that the system is producing all of this information, gathering all the data on an automatic basis without intervention. You don't want to be worried that a key person went on vacation, and because of that, something's not going to be available. And then finally, again repeating, to monitor the usage. That's the best way for you to know whether or not certain reports are, in fact, meeting the needs of the end users. And with that, Marilyn will come back on, and we'll see if you have any questions. We would be happy to answer them. And thank you very much for taking the time to spend some time with us. We really appreciate it.
And thank you, John, for the vital information and great advice. I would ask you, John, could you just say a few words about the Polaris service, which is so unique in the market and valuable to our customers? Because we are not just a tool vendor.
Right. When we started out, we've been in the industry forever, and there are many, many tool sets out there that can be used to do reporting. So you wonder why when you go into all of the different hospitals, you find that they're struggling. They have all the issues we talked about, very slow to respond to requests, multiple answers to the same question, etc. And it's usually that even though they have a reasonable tool set, I mean, we could argue back and forth about which ones are better, which ones are worse, but they have a reasonable tool set, but nobody really became an expert at that tool set. Or somebody did, but that person went on to a new position or whatever. So there's no one there to actually do all of these things we were talking about. Excuse me. So we decided to take a totally unique approach. We are a service. We are a reporting service. So what happens is our clients pay us an annual fee, and for that, we just work with them continuously. They don't have to worry about, well, we would like a report for this area, but gee, that's going to cost us another $5,000, and we've already spent our budget. That doesn't happen. They pay what is an extremely reasonable annual fee, and then we become an extension of their staff. Everything we do is on our client servers. Their data stays with them. It's never coming over to us, etc. And so that is very unique. We really don't know of anyone else. I mean, there are people who provide services for building reports where on a project basis you go in, you pay a fee, etc. But that's not at all what we're doing. We find that the bringing together of a great tool set with the expertise of people who have worked for years in healthcare-specific decision support, reporting, and data visualization really makes a difference. And we're very happy with the results so far, and our clients have been great. I think we've had some really great results.
Great, John. Thank you so much. And now I'm going to just unmute everyone, and if anyone has any questions, that they just speak up. So okay, I'm opening it up. Any questions? Okay. We have recorded today's webcast, so if you would like to review it or you would like to share it with a colleague, you can find it on our Polaris YouTube channel. Thanks for joining us today. This concludes our webcast. Bye-bye.